and thanks a lot for joining this second special webinar of our DeBern lectures in 2020 on COVID-19 and planetary health and new perspectives. Today we have the pleasure to have here Josep Antó. I personally see as, when I started my PhD in Spain, I remember his name in every single paper in environmental epidemiology. And for me, it's really a pleasure that you accepted our invitation and to hear your presentation about this relevant topic. So just to give a very brief introduction about Josep Maria. Josep Antó is a respiratory physician, epidemiologist, whose research has focused on epidemiology of asthma and COPD with a special interest on the environmental determinants and prevention of these diseases. He is professor at the Barcelona Institute of Global Health, so-called IS Global, and at the University Pompeu Fabra. Among other leading positions, he has been the founding director of the Center for Research in Environmental Epidemiology, the former CRIAL in Barcelona, and the founding scientific director of IS Global. During the last years, he has been increasingly devoted to adapt environmental health strategies to the fight against climate change and to promote the concept of planetary health locally and internationally. So just a couple of housekeeping issues. Remember to please put your microphone in mute. And Josep Maria will give a presentation of around 35 minutes or so. And afterwards, we will have our Q&A session. If you want to start putting some questions in the chat, it's perfectly fine. Otherwise, we can wait until the end. Okay. So Josep Maria, the screen is yours. And thanks again for accepting our invitation and being here today with us.
So thank you very much, Anna. Thanks for your kind words and the nice presentation. So hello, everyone. It's a big pleasure to be here with you, even if it's an in silico pleasure, which is increasingly, unfortunately, nowadays. I'm very grateful for your invitation. So I thank to those of you who have been designing the program of sessions and putting me on the list. So thanks to Anna and to Oscar Franco and Thomas Abel. We have corresponded a few through email the last month. It would have been great to meet face to face, but I hope that this will be just the first opportunity, and I will have another one to visit you as sooner the better. It's not only a pleasure, I should say it's an honor and it's an opportunity. An honor because I have a high respect and admiration for the research that is doing in the Institute, and I'm familiar with some of the research lines and have a very high respect for what you do. So it's an honor that you included me as a lecturing here. But it's also an opportunity. It's an opportunity because I consider myself a newcomer to the planetary health, and then being a newcomer, you gain a lot by having the opportunity to share with others and to have questions and suggestions, and so in this sense, thanks, double thanks for the opportunity. Just Anna went through my credits, and I have no specific conflicts of interest to disclose. And this is the outline that I will follow in my presentation. I will start with my personal journey to planetary health. And then from this, I will try to discuss a bit about the purpose and mission of public health and epidemiology, about the subjects of interest, implications for methods and technology, our impact agenda, and finally, a few comments about the road ahead. And let me begin this personal journey to planetary health with one big challenge, which I call the climate crisis challenge. And these are the big names you have here: Ban Ki-moon, Mary Robinson, the former president of Ireland and delegate for human rights of the United Nations, and the current General Secretary of United Nations, Antonio Guterres. And these people and many other very influential people have recognized that climate change is probably the largest or the biggest challenge that humanity has faced so far, which are very, very big words. But unfortunately, it's not only climate change. So the real challenge is even broader and bigger than climate change. And this is what we see when we look to the concept of Anthropocene. And this is one of the founding papers in Science, providing evidence that the Earth today is functionally and geologically different than the one in the Holocene. And probably the main differences is not only the climate warming for the greenhouse emissions, but also the big issue of the biodiversity and the extinction of species, with the prediction that even more than 75% may be extinguished in the next centuries if we don't stop the current pace. And also the big pollution issues like the universal ubiquity of microplastics, the permanent layer of airborne particles in our atmosphere, not only in the cities, everywhere, and also the big disruption of the nitrogen cycle in the soil, which is unprecedented in the last millions or thousands of millions of years. The other concept that probably it's very close to this idea of the Anthropocene is the planetary boundaries. So the recognition that in the Earth and the natural systems, there are some thresholds beyond which the likelihood of extremely disruptive and unpredictable events is increasing, and that this adds to the existential challenge that I was alluding. Well, the second challenge is what I call the small, slow reaction. And then I say, well, why the biggest threat to humanity is not shaking the health systems enough? And to substantiate this challenge, I put you here two figures that for some of you, I'm sure are extremely familiar. These are assessments of the environmental burden of health. And in the left, you have the WHO, and in the right, you have the Lancet Commission on Pollution and Health, published in 2018. And in both, you have, well, in the left, you have the environmental share of diseases like cancer, depression, COPD, cardiovascular, asthma, etc. And in the right, you have some of the leading causes. It's a mix of factors and diseases and the burden. And you can see here, for instance, the 9 million deaths attributable to pollution, total pollution, the different sources of pollution, not only air pollution, or the 7 million deaths attributable to smoking. And then what is relevant for me here is when you look to all these factors, both sides, in the left and in the right assessments, you don't see climate. So climate change is not flagging up as a leading factor of our burden of health. And then this probably explains part of this challenge, why we are not transforming rapidly our health systems. So if we don't see climate change in the top factors of the current burdens, this probably explains part of our slowness in reaction. And this is a work from an artist from Galicia, northeast of Spain, Isaac Cordal. This is has years, is a collection of works, was called Follow the Leaders. It has been updated now by Isaac Cordal in the context of the climate change. But I used to say that I can see myself as part of this group of businessmen doing business as usual. And in our case, business as usual mean keep discussing for a long while whether we need to include a new course on planetary health, on climate health in our Master of Public Health, or whether we need to open a new line of research to really go into these issues. But these discussions take always a lot of time and evolve very, very slowly. And the change to this attitude for me came in a way very unexpectedly when I read in 2015 this paper. This paper now has more than 1,000 citations, so it's a very well-known paper. It's the Rockefeller Lancet Commission on Planetary Health. When I read the paper in 2015, the first surprise for me was the title, Safeguarding Human Health in the Anthropocene Epoch. I was not very familiar with the Anthropocene at that time. And then the surprise and the excitement was growing with each page I was reading in the paper. Something that was striking me was what they call a paradox, or a fundamental paradox. And this paradox is very now well disseminated. At that time, it was not well known, but this paradox is the paradox between improving health and the deterioration of the planet. And this is a short summary of the figure in the paper. And it's showing you that in the last 50 years, we have seen a big improvement in many parameters of population health. This is population size, poverty, life expectancy, but in many others. And at the same time, we have seen the opposite pattern with the parameters that we can use to measure the health of the planet. And here you have the shortage of water, ocean acidification, or the carbon dioxide. And you see that in the same 50 years, we have seen our health improving and the health of the planet deteriorating in a very big degree. And then this is a paradox. And for a person like me and some of you, probably for you as well, Anna, that we have been for many years saying environment is very important for health, then how we can explain that at the same time that our health has been improving, the health of the planet has been deteriorating? Well, if the relation is so direct and close, we should see the opposite. Well, there are no clear answers to this paradox. There are many of them. I have my ones. No time here to discuss that. But let me say that this graph involves also an important message, that the two patterns, the improvement of health and deterioration of planet, involve a big inequality. So for health, this improvement has not been equal for everybody. There are huge and unacceptable differences between countries, and also huge and unacceptable differences within countries. And at the same time, the factors driving the deterioration of the planet, the ones we see here, are not the same for everybody. So the countries who have benefited more from these impacts are the ones that are suffering less the consequences of that. And this is an important concept in the planetary health approach. Well, the important thing is that, to me, probably the more important answer of the Rockefeller Lancet Commission in this paper is that the response or the reason of the paradox is that we are using a wrong definition of health. A definition of health that does not take into account whether the health gains are achieved at the cost of eroding the Earth underpinning natural systems. And then they define planetary health as the highest attainable level of health and well-being for humans, in an equity, in a world in which we pay judicious attention to the human systems, the political, the economic, and the social ones, that are the systems that are shaping the Earth natural systems in which humanity can develop. It's a relatively complex definition, but to me, it translated to a very simple sentence that it was obvious to me, like a revelation at the first reading of the paper. And I decided to put this in the top of my agenda. And this sentence is very simple. Human health and the health of the planet should go together. Well, this is another work by Isaac Cordal, and it's probably inspiring different things. But to me, it has always inspired the fresh air and the influence of the young generation that are the ones that are driving the change and giving this type of businessman to which I see myself sometimes, giving an opportunity to react and change our mind. Well, from this change in the way of understanding health, which are the consequences for the purpose and mission of public health? And I will be very short in this. Well, this is from the Oxford textbook of Global Public Health, defining the goal of public health as the biological, physical, and mental well-being of all members of society, and then involving the challenge of confronting health problems and the political, social, economical factors that are driving our health, and this not only at our community, state, national, international level, at a very global level. But if we change our concept of health and we start to see beyond human health, then I see the opportunity for broadening the purpose and mission of public health. And here, from the planetary health perspective, my proposal is that health refers not only to humans, but also to all living beings, the social systems and the natural systems of the earth, and that they should be seen as an intrinsic part of our concept of health. Well, in this way, human health and the related factors should be seen as well as determinant, or what we say risk factors, for the health and disease of the other living beings and the social and the natural systems. And in consequence, we should, as humans, be open to consider trade-offs between our health and the health of the future generations, because the social and the natural capitals are the one that are the base for the development of the future generations, and also consider trade-off between our health and the health of the other living beings and the social and the natural systems. And in this way, I think we have the opportunity to change the purpose and the mission of the public health. If we change purpose and mission, then probably we are changing the subjects of interest. Well, very important, the paper of planetary health. It's a paper of about 50 pages, hundreds of citations, extremely good evidence organized in the paper, and they also charted a course for the future. And in this course for the future, they include a number of typical fields for planetary health. Some of them are related to food systems, food production, sustainable aquaculture and fisheries, low environmental diets. Others are related to co-benefits of health and environment, including air pollution, management of chemicals, sustainable cities, and also other related to health services like improved access to family planning or integration of environmental care. And this is an extremely rich part of the paper, and there is a lot of research and evidence coming in these fields. But when you look to all them, it's relatively complex to have a straightforward idea of what is really specific and unique in planetary health. And then, you know, epidemiologists, we always go to our 2x2 tables to make things easier to understand. And then I went to my personal 2x2 table for planetary health, and I started to work with this table. And then this table, it's very simple. It puts one side human health, the other side the health of the planet. And then in this way, you can look to things that are bad and bad for the humans and for the planet. And I suggest smoking. And then there's a good reason to go ahead with eradication of these problems in a very radical way. And at the same time, you can look to the things that are good and good for us and good for the planet. And I suggest active mobility, and then extremely good opportunity for escalating these factors and strategies and making them fully accessible in our world. And then you go to the cells of the table that are a bit more complex, the one that is good for humans and bad for the planet, and I suggest health systems. And the other one, even more complex, when you have things that are bad for humans and maybe good for the planet, and I put COVID-19 with a question mark. So let me now very briefly go to each of these 4 cells just as an example. So first thing is tobacco and smoking. Well, being a respiratory physician, I must say that I don't remember a single lecture fully devoted to smoking when I finished my medical degree in 1975. And I think that most of our students nowadays, at least in Barcelona, still don't see a full lecture on climate change when they finish the medical degree. I hope this is different in Switzerland. But after starting to be excited with planetary health, it was in the context of preparing a lecture for a respiratory medicine society that I went to PubMed to look for smoking and climate change. Surprise, few papers, but a very important WHO report in 2017, showing that tobacco is one of the most environmental destructive agricultural practices worldwide. It's an important driver of massive use of insecticides and chemicals, important driver of deforestation, important driver of loss of biodiversity, an important driver of desertification. And the full smoking greenhouse gases emissions, which is about 0.2% of globally, is equivalent to some countries like Peru or Israel or the double of Wales. So extremely good justification to eradicate smoking, as already some parliaments in Europe are starting to put on the agenda, in particular Finland. So the second example, which is in this case opposite, instead of bad, it's good, and I suggested active mobility. And this is almost a 10 years old paper developed by Mark Neuhausen group in Creal at that time, now ES Global. And the trigger of this paper was, the research question was, the drivers who decide to keep a car aside and take a bike to commute, are they going to be more exposed to death and morbidity due to injuries, traffic injuries, and air pollution? And then they did a mortality assessment. Many sophisticated studies nowadays. At that time, simple mortality risk assessment, but probably the first or one of the first. And the result was, yes, there is a small increased risk in traffic injuries and exposure to air pollution, and a small increased risk of mortality for these reasons. However, these risks are highly offset by the benefits of physical activity. Magnitude of the ratio 10 to 1 in favor of physical activity. But at the same time, they estimated the CO2 equivalent emissions that were saved every year in the city of Barcelona by the 180,000 bicycle users. And it was 9 million kilograms of CO2 per year. So providing a very good evidence for the message that using bikes for active mobility was good for the health of humans and for the health of the planet. And then adding to the evidence that this type of strategies deserve full support because they are addressing one of the more or the biggest existential threat of humanity, that is climate change. Let's now go to the more difficult cells. So the things that are maybe good for humans, but probably bad for the planet. And I know that saying that human systems are good for the health needs also to say, well, when use it appropriately, we know how much iatrogeny is, but at the same time, we know that well-used healthcare is very good for human health, and the universal access of healthcare, it's one of the challenges. Well, in this study, Australian authors did look to 13 different types of healthcare expenditures and came with the estimation that 7% of the total carbon footprint in Australia is attributable to healthcare emissions, mainly public and private hospitals and pharmaceuticals, and altogether suggesting that there is good reasons to take this seriously. If we take this seriously, then the challenge is how we can make health systems good for the planet as well. And there are some hospitals leading the way to make hospitals sustainable, to make hospitals committed with the community surrounding or hosting the hospitals, and working with these communities to develop regenerative transformations to make the nature, the urban nature better, not only for the local, but also for the global. And finally, probably the more difficult one, which is the COVID. Obviously, when I started to work on this idea of the planetary health, in the same way that when you started, Anna was telling me that originally you wanted 2020 to be a year to put your institute attention to planetary health, but then it came COVID and did change the things. So it has been some suggestions that COVID may have been good for the planet. Well, here you have a paper in Nature Climate Change looking to the daily global CO2 emissions worldwide during the confinement. The authors took together all the policy confinement strategies together with emissions and came to the estimation that at the early April, there was a 17% decrease in CO2 emissions worldwide, with the highest peak 26 degrees, but probably when you estimate an average for the full 2020 year, they estimated that the annual decrease will be about 4 to 7% decrease. Taking into account the persistence of the pandemic and the need to maintain confinement, it may be closer to 7 than 4, but this is still to be seen. However, to put this in perspective, so how good this is for the planet, well, this corresponds approximately to the level of decrease, this 4 to 7%, to the level of decrease that we need to do every year if we want to meet the International Panel Climate Agenda. So we will need probably for the next 10 years, at least 5% decrease. So in a way that in 10 years, we can halve the CO2 emissions. You will see this later on. So this is just in the best scenario, a small relief for the planet, nothing extremely good for the planet. So probably if we take into account other things, maybe even very bad for the planet, but we need more evidence on that. From the perspective of the human health, with Christina O'Callaghan, which is an associated researcher in ES Global, and Christina is probably the first professor, at least in Spain, of planetary health. She has been recently appointed professor of planetary health in the Open University of Catalonia. And with Christina and other colleagues, we have put forward a proposal for a master in planetary health that it's hopefully starting in next year. We went to reviewing the evidence linking the COVID with the climate change and Anthropocene. And we came with this idea that we reported in environmental research that the COVID-19 can be considered a disease of the Anthropocene. And this is in part because there is evidence of large scale and systemic environmental impacts being related to a spillover of viruses to humans, like it has been evidenced in previous zoonoses like MERS, SARS, Ebola, and others. And then together with demographic changes, social changes, and economic changes, we suggested that altogether fit with this idea of the Anthropocene. And you have some of the supporting papers here in this slide. So regarding to this idea that COVID-19 may have been bad for humans, but good for the planet. This is still probably early to make a final balance, but most likely we need to move to the left in the 2x2 table and probably say that at the end this will have been bad for humans and bad for the planet too. Well, this is a paper by a group of evolutive biologists extending the evidence. They are really authors that have been leading this field for the last decades and providing strong evidence of these interactions between COVID-19 and biodiversity, loss of biodiversity, and the importance of attending the common risk factors for the COVID and for the climate change. Well, just accepting that these are examples of how we can broaden our subjects of interest in planetary health, but then there are implications for the methods and technology. And this is a more difficult issue. I will touch it superficially, but what I think is that we need changes in methods and technology. You will not understand, sorry, the art of Isaac Cordal in the slides that I did show if you don't know exactly the methods and the technology that he is using. And the same happens with science. And in this case, to me, it's obvious that we need to deal with the global scope of these challenges and the complexity. And we need to address with urgency the need of transformative changes, big transformations. And for this, I suggest that we need to improve our current methods, to develop new methods, and very importantly, to reinforce and escalate our alliances with other disciplines. Well, this is a call for efforts and creativity, and now we are at the very beginning of this new step. But let me, from this personal point of view, put two examples of research that to me are inspiring the need of new methods and technology. Well, one is this study of the environmental footprint of tobacco, showing that each cigarette has 3.7 liters water footprint and 14 grams CO2 equivalent. I mentioned this before, but this is to say that today I more and more believe that environmental epidemiology is another type of epidemiologists as well, even health services epidemiologists need to consider the methodologies for assessing not only the impacts in humans, but also the impacts into the planet and incorporating the methodologies. So this type of life cycle assessment of carbon footprints, incorporating these methodologies to our arsenal. This is another paper in Lancet Planetary Health, and it's looking to cumulative health co-benefits by mitigation costs. The first author is Anil Markandaya from the Vast Center of Climate Change. And they are looking, these authors are looking to the economic cost and the economic benefit of climate mitigation strategies. So you have baseline scenarios, and then you have 3 scenarios for policies aimed at stopping warming at 2 degrees, and 3 other scenarios for stopping warming, global warming at 1.5 degrees. And then in this study, they used 3 types of models. One is global climate assessment models to estimate the emissions and the mitigation cost for each one of these scenarios. Then you use this TN5 fast scenario screening tool, and they go from emission levels to air pollution and health impacts of air pollution. And then they use the statistical value of life to monetize the premature death and morbidity. And the results of the study show, as you see here, that the economic value of the co-benefits are far larger than the cost of mitigation. So in other words, these mitigation strategies can be economically covered by the co-benefits that are associated. Importantly, this is not homogeneous worldwide. So the benefit, the ratio, it's even better in countries who are not as big contributors to climate change, like India, for instance, or many other countries in Africa. This is the benefit is extremely positive, and it's maybe negative in some of the rich countries who are big contributors to climate change. But the message to me is of extraordinary importance. We need to pay increasing attention to this type of global complex modeling that puts together human health and the health of the planet as the same subject of interest. And a final example on biodiversity and asthma. This is an example showing you increase of prevalence of asthma in Finland, as in many other countries, epidemic increase. And this, in the lower left side, you see evidence from the Karelia studies showing that the sensitization to allergens, in this case birch pollen, was very high in Finnish people that were born in the Finnish part of the country, as compared to those who were born in the Russian Karelia, where there was almost no increase in sensitization to pollen. This type of evidence, with many other studies, allowed Tari Hatela and other people in Finland to suggest that the explanation of asthma, rise and allergy may be in part decline in biodiversity through microbial deprivation, two parallel pathways, one disturbing immune responses, the other one creating microbial imbalances in our bodies, and both going to high risk of inflammatory diseases, which is a characteristic of allergy and other common chronic diseases. And this was a driver for these authors formulating Finnish allergy program in a creative way. You have a review in 2017 suggesting something that was very new at the time. So don't focus on allergy, focus on endorsing health. Don't put avoiding allergens as a main strategy, put improved contact with nature. Restrict avoidance of allergen to situations when it's mandatory. And then framing a very innovative allergy program. And I've been working with Tari Hatela and other people in Finland to translate this fully into a planetary health with principles like endorsing the planet, contributing to protect and regenerate nature, understanding and strengthening the role of biodiversity, promoting planetary sustainable diets, and so and so. And I think that these three examples are hopefully inspiring the opportunities for improving our methodologies and technologies in new subjects for planetary health. More specific suggestions you can find in the HERA Horizon 2020 research project, proposing research goals on environmental climate. Some of you have contributed, and here you can find very stimulating ideas about developing new methodologies and new technologies for the planetary health agenda and the evolution of our disciplines. Let me now, in few slides, move rapidly to the final impact agenda and the road ahead. So again, a work of Isaac Cordal. Now it's a work done during the confinement. It's being exposed in a part of a COVID-19 exhibition, works in Hong Kong, where people, it's fighting against not only climate change, but also fighting for democracy. And the main message here for me is that in the context of the planetary health ideas, we need to address challenges that are at the same time urgent, global, and complex. This goes together. And we need to address these challenges to support large transformative changes. This is what we need for the next decade. Well, the urgency, it's not just a label, it's not just verbal urgency, it's based on strong evidence, science evidence put forward by the International Panel of Climate Change. We need not to exceed 1.5 degrees. And for this, we need CO2 emissions reduced by 40 to 50% in 2030. This is less than a decade, and reach zero level by 2050. We are very fortunate that we have an agenda for that. We now don't need to spend the next years discussing how to go forward with this urgency. We have the agenda, and this agenda is the SDGs. And the SDGs provide another fundamental message, that even if we can achieve a planet that is sustainable, if we don't address the socioeconomic issues and the fundamental inequalities in the distribution of health and well-being, we will leave humanity far short to the aims of the SDGs. And to me, this can be again summarized in a very simple sentence. We need for the next decade strategies that are aimed at achieving zero poverty, zero emissions. There is a momentum in Europe. We have the Horizon Europe for the next years coming, and the European Green Deal. And you have the missions that this type of moonshot-like strategies. One is cancer, but the other four are related to climate change and the Anthropocene. When you go to the documents of the missions, there is not much about health, but this is our challenge and our opportunity. We need to find our role in these missions if we want to be part of the solution. Finally, the road ahead. We need to think in terms of post-COVID strategies. COVID is going to be here still for the next month, but the consequences probably for the next years. And I think that we need to remind that focusing only on the emergency and the mitigation measures of COVID will constitute a major missed opportunity. This is not a message coming from traditional public health. This is a message coming from a group of evolutive biologists. Some of the proximal and distal factors of COVID are common with the Anthropocene and the climate change. And then this provides the basis to fight against these factors through the SDGs and the Paris Agreement, and to move from COVID to the SDGs and the climate crisis. So let me finish suggesting that it's now the time for planetary health. And this is not saying from the side of health, this is saying from the side of environment. This is the cover of the GEO6, the Global Environmental of Assessment, reported last year. And these are the principles as put forward by the chairs of the GEO6, saying a healthy planet supports healthy people, and healthy planet leads to unhealthy people. The drivers and pressures leading to an unhealthy planet must be addressed. Current science is enough to justify policies and action ready now. Environmental policy, and I would say public health, is necessary, but it's inadequate by itself if it's not addressing the systemic ecological problems. Healthy people, healthy planet, a healthy economy can be mutually supportive. Thank you very much for your attention.
Maria, thank you very much for the excellent presentation. Very, very stimulating, and I'm sure that for the audience, it has been like a point for thinking a little bit more, seeing a little bit the vision ahead. And I personally see that it's clear, the message that you just tried to give to us, that planetary health is about, it's now the time, as you said, And it's really the key message there is that it's a complex and urgent and a global issue. And even if we want to really address it for the next generations, we have to think in global, think about the complexities, the benefits, and these, what you say, these balances between investments and the benefits for health, for the planet. And eventually we have a huge challenge again, but I think we have the tools, we have the opportunities, and also we are now in a process of transformation, of research, of population, of everything that is changing. We have to really use this boost to move forward, to take the opportunity and really address these challenges that possibly in the future we will have more, like another pandemic or you know, maybe something similar. So again, thanks a lot. And yeah, I think it's we have now 30 minutes for a few questions. And I see one from Thomas in the chat. It says, wonderful introduction. A question regarding the list of future topics. What are the pros and cons of not listing here equity as a key topic and goal?
Well, thanks for the question, Thomas, because I think this is a fundamental question. And I think that, as I tried to emphasize with in several slides, I think that the question of equity should go hand with hand with the sustainability. Will be no sustainability for the humanity without equity. I think that this is, to me, one of the fundamental contributions of the SDGs. I mean, equity is a concept that it's framed into the heart of the SDGs. And I think that this is a reminder we should to put ourselves every time. I mean, it's achieving equity without, achieving sustainability without equity, it's not an option. But it's not an option if we think in terms of human rights and health as a human right. But unfortunately, it may be an option in the world we live. And I think that there is a risk. There's a risk for, and there is evidence of a risk for big companies using sustainability as a greenwashing message, and companies that are contributing to inequities, and they can use sustainability strategies as a greenwashing strategy, which is very unfortunate. But we can also see in some countries a context for achieving or moving forward to sustainability with persisting inequities and even challenging democracy, which is even more complex. So I fully agree with you that these things should be insoluble together. I mean, we cannot separate both things, and there are many implications for this.
I find this absolutely convincing. It was just that in one of your earlier slides, you had these tasks or issues for the future. And then they didn't list this at all. They were more, you know, the traditional public health science without this as framing, this is our perspective. No, this is where we want to go, like the SDGs plus the Paris Agreement, the two of them together. So shall we do how can I say, what you listed on that slide early on? Shall we do this first and then later on bring in the discussion on equity? Or should we have the equity first? Or should we have the equity even integrated in this list? That was a bit of my question.
Well, this is made. Yeah, thank you, Thomas, for the comment. You are fully right. This may be my fault in when I put the slide of the roadmap for the future from the planet, from the Rockefeller Lancet Commission. I can tell you that if you go into each of these sections in the paper, so equity issues are fully considered in detail. I mean, And then in many, what it's important is that to understand that these equity issues are fundamental part of the challenge. If you go to the example I put for the co-benefits of mitigation and health, and then you see that the strategy forward is that we should find a way where the countries that have benefited the more with the natural resources should now contribute the more with the ones that will be more impacted by the consequences. And here you need again to put together these sustainability strategies in a context of equity. Otherwise, it's no solution.
Thanks, Josep Maria and Thomas, for the nice discussion. I see as well Matthias Egger.
Yes, hi, can you hear me? Hi, Josep, nice to see you.
Nice to see you
It's
too,
been a long
Matthias.
time.
Yes, nice to see you.
I wanted to ask you something which is close to my heart at the moment, based on my experience in the Swiss National COVID-19 Science Task Force, which basically outlined the way how, we should deal with this epidemic, what measures should be taken, when, how it should be monitored, etc., based on sound scientific data. And the experience then was that this advice was essentially ignored, and we ran into a massive second wave, etc. And the question that really haunts me is, how can science be heard? How can science influence public health policy? And of course, the same issue is highly relevant to climate change, although on a different timescale. With COVID-19, we were talking about weeks and days. Every day counts. And of course, the climate change issue is becoming more and more urgent, but not quite on that scale. So I was just wondering, how can we prevent that politicians do the massively wrong things, do not act when they should, while preserving democracy? Over to you.
Well, Thomas, Matthias, this is a too difficult question for me. It's interesting that you put the question, because the scientific advice for COVID in Spain has been and it's being a mess. And sometimes I put Switzerland as a positive example. I say, please, guys, look to Switzerland. There is a high-level advising committee, and it's chaired by someone like Matthias. So we need to do in this way. But then you came and say, well, but the politicians don't take the science evidence seriously. And Matthias, frankly, I think this is one of the more painful lessons to me of this crisis. I think that we are seeing the end of an old paradigm in which the dialogue between policy and science was relatively well vertebrated. And it's not more than like that. I mean, I think this has been one of the fundamental failures. I have no answer, but I'm convinced that we need to rethink how do we work in the future. I mean, I don't know, maybe we need to take more independence from our side as scientists and going in parallel to the politicians. I don't know. I'm now participating in the Lancet COVID-19 Commission that is chaired by Jeffrey Sachs. And I'm trying to promote this issue as an area for work. I mean, I think my intuition is that we as a scientist and scientific societies need to strengthen our strategies to provide advice to the society. And in a context where the dialogue with the policymakers and politicians may not work.
Thank you.
Perhaps I can, if I may add on this. I find this one of really also one of the key issues here and the challenges is, and I would like to bring in here complexity. That is the complexity in the science and the complexity in the politics and in the political arena. And these politicians are now enormously challenged also by the urgency of action, the complexity they have to deal with. And now this is met by a science that is also just emerging. There are certain things we really know, almost something like for sure, but many things we don't know. There was this discussion organized by the British Medical Journal on the knowns and the unknowns. And this kind of helps us to understand why in such a condition, we are even less heard. I mean, we used to say, why are they not listening to us? Why don't they look at our data? Now it's even worse because they have enormous pressure. There's enormous political lobbying, complexity on this side, meeting a big part of unknowns on our side. And that is part of the explanation, only part of the explanation, but it may help to understand the picture overall of it.
Yeah, fully agree. Thank you.
Well, I see there are a couple of questions in the chat, but I see, for example, the first one was very similar. I mean, it was related to the same thing that you were discussing now. The second one by Zaine. Well, maybe Sven, I think that you wanted to say something.
No, I wanted to say exactly what you just said, that Matthias asked a similar question. Just one point I would like to echo is that maybe we should also stop to think too much that there are different, let's say, groups trying to interact with each other. So that we have, on the one side, we have the science community, and on the other side, we have the politicians. Maybe we should start to somehow gain or build up more like a team feeling also for the politicians, so that they feel that they are heard also with their inputs, and that maybe we can influence them more, you know, on a different level than trying to teach them, but more to engage them, and maybe they have the right thoughts in their heads, but they are in a real tensioned field. So yeah, that's a bit.
No, I think I coincide with you, Sven. If we look to the countries where the failure has been bigger, I mean, like US with Trump, obviously, but also with UK, I mean, where there has been clearly attempts from the political side to manipulate the message of the scientists. And then, I mean, for instance, I found interesting in UK, the independent, you call the Indie Search Committee. I mean, well, UK has a tremendous scientific muscle, and when they saw the difficulties of interacting with politicians, they arranged an independent scientific committee. And I think that this independent scientific committee, which was working with no interaction with the government, has made a big job, frankly. And I think to me is an example of one possible strategy. I mean, and as you say, I mean, we need probably to I mean, we cannot, I mean, we cannot work. I mean, politics are important. Without politics, we cannot move forward our societies. So we need politics, and we need healthy political climate. So we cannot resignate ourselves to live without politics or with miserable politicians. But at the same time, we probably agree with you that we need to develop more independent strategies.
Thank you.
I don't know exactly what this means, sorry, but.
Well, unfortunately, the time completely ran out of time. And well, again, thanks a lot, Josep Maria, for being here. And I think that, as you said, that hopefully we will have another opportunity in the future for having you face-to-face in ISPM. So again, thank you very much. Thank you all of you for being here in this webinar. And yeah, muchas gracias, Josep Maria. See you.
Thank you very much, Ana. Gracias. Thank you very much. I promise to visit you as soon as possible if you invite me.
Of course, the invitation is there already.
Good luck and take care.
Thank you.
Bye-bye.
See you.